everybody. Happy quarantine. I hope y'all are safe and healthy. For our treatment paper, Abby Werner and I looked at treating short-term and working memory. Most of the literature we looked at focused on aphasia due to stroke, but obviously you could have aphasia with other brain injuries. But all of the research that we looked at, the treatments were targeted for post-stroke aphasia. They define short-term memory as temporarily maintaining and retrieving information in serial order. That's from Zacharias and his researchers in 2019. They also define working memory as very similar to short-term memory, where it involves maintaining and retrieving stored information, but they also, working memory includes a level of mental manipulation, so it's a bit deeper than short-term memory. There are several ways to treat short-term and working memory. Our paper focuses on sentence comprehension. Obviously, we know that levels of cognition overlap, so if you're treating memory, you're often also treating attention and language, but we want to not focus so much on the attention side of short-term and working memory, but focus more on the working memory and sentence comprehension and things like that. One of the most common ways that we saw clinicians treating short-term and working memory was with a digit span task. This task is really simple, really easy. You just say a series of numbers, starting with 2 numbers and working your way up to 9 digits, and just having your patients say those numbers back to you in serial order. So if I say 4-1, my client says 4-1, and you can then do 2-9-8, and they say 2-9-8. Working your way up to 9 numbers, and then if you want to make it even more complex, you have them say them backwards. Salis in 2015 wrote a paper talking about how a lot of clinicians use digit span. It is super easy to administer, like I said, and it focuses more on the phonological side of short-term memory. There's a phonological component and a phonological and semantic component of short-term memory, and this is more of just the phonologic. They recommend using digit span but not using it in isolation, so incorporate another treatment along with digit span to target more of the phonologic semantic underlay of the deficit. Another treatment approach that we looked at was the matching listening span task of words. So in this task, the clinician will say a word list including 4 words, and then say another word list including 4 words, and the client just has to say if the word lists were the same or different. For example, if you say dog, chair, couch, ball, and then dog, chair, ball, couch, those word lists would be considered different, because again, we're really wanting to look at that serial order to make sure things are said in the same order. This task is great because if you have a really severe aphasia or a global aphasia where spoken language is hard, you can just have them push a button that says same or different. They can nod. It really helps those nonverbal or more severe expressive aphasias. I think that's it for my 2 treatment approaches. Now I'll pass it on to Abby, and she'll tell you about the one that she looked at. Thanks.
Okay, so I'm going to talk about the 3rd treatment approach that we cover in our paper, treating short-term and working memory. So this treatment approach is called the sentence repetition approach. It's a very popular treatment that clinicians use. It's very versatile. So you can use it in a hierarchy or model. So you could start out with maybe 2-word sentences and you can build your way up. You can do it in different contexts. So you can have the patient repeat the sentence to you immediately, or you can have them repeat it to you in a more delayed recall, making it a little bit harder to remember what the sentence was. Or you can change it in the sentence grammar form, so you can make it a little bit more difficult. So you could have a very basic declarative sentence, very simple sentence, short and sweet, or you could have a passive sentence that might be a little bit more complex in the way that it's grammatically formed. So you can use it in a variety of ways. It is encouraged to use probably in a more combined method. So you might use it with the digit span or the listening span task like Kelsey talked about, instead of in isolation. And this is due to the test and retest reliability effectiveness being not as strong when used in isolation. But the study that we looked at was by Salis, Helen, and Kelly, and this was done in 2015. And they looked at overall assessment and treatment of a post-stroke aphasic population regarding short-term and working memory. But just to kind of break it down for you, they looked at specifically sentence repetition at the end and its effectiveness on the population. And overall, it did show improvement in the language skills and working in short-term memory of the population. And they discussed two very specific approaches within that treatment, which was distributed approach, and this was more of an immediate with the clinician present method. And then they looked at the masked approach, which is where it was in absence of the clinician and might have been at home listening to pre-recorded sentences. And those are two very specific approaches that can be used within that treatment. Neither one showed significant differences in its effectiveness. Just overall, sentence repetition therapy did improve the working and short-term memory skills, which carried over into their language skills of functional daily life and their verbal communication. So it is backed up to use, but use with caution as probably in combination with another treatment approach. And overall, they just concluded that we as clinicians need to be assessing and treating short-term and working memory, just depending on what that patient needs specifically and how you go about it. So thanks for watching.